everyone. Thank you for being here today for this important announcement. I'm pleased to be here with my colleague, the Parliamentary Secretary for Rural Health, Martin Long, and some of my other colleagues are here as well. We've got MLA Garth Roswell and MLA Scott Sear that are over here. Wave, everyone. And I just want to double check I'm not missing anyone. Nope. And of course, the Mayor of the town of Hinton, Nicholas Nissen, to share the work Alberta's government is doing to improve healthcare in rural and remote Alberta. Last summer, when I received the Premier's mandate letter, one of the key priorities highlighted was the need to improve healthcare in rural and remote areas across our province. This critical focus was just one of many important areas outlined, but it stood out as a vital step in ensuring that all Albertans, no matter where they live, have access to the healthcare services that they deserve. Rural residents continue to face challenges such as fewer healthcare providers, longer wait times, and the need to travel long distances for care. These barriers underscore the urgent need for a more equitable healthcare system across the province, and we are actively working on solutions to address this issue. We are focused on identifying and tackling the specific challenges rural Albertans face when it comes to healthcare. We are developing tailored strategies to improve access to medical services, ensuring that rural communities have the resources, the personnel, and the infrastructure needed to provide quality care. Whether it's recruiting healthcare professionals to work in underserved areas or improving the delivery of critical services, work is being done to close the gap and ensure that rural Albertans receive the health care that they need. We are committed to making healthcare better for Albertans living in rural and remote parts of the province, and it shouldn't matter where you live. So we are exploring innovative solutions to provide you with access to the best care possible when you need it most. That's why I am proud here to stand here today to announce the launch of a new Rural Health Action Plan. So this 3-year plan will guide government's efforts in improving rural and remote health care and closing the gap between Albertans' care in urban centres and in surrounding areas, and making sure that they get the care that they need in rural and remote communities. So it's really emphasizing the rural remote communities having the care that they need. And through this action plan, there will be key focuses. One being access, another being community care, the third being prevention and wellness, the fourth being workforce, and the other key area is the fifth, which is creating innovative care models and solutions that serve the unique needs in rural and remote communities. So these areas of focus align with priority projects, such as the Modernizing Alberta's Primary Care System initiative, and of course, Alberta's Health Workforce Strategy. This plan also aligns with system refocusing efforts in primary care, acute care, continuing care, and mental health and addiction. Over the next 3 years, the action plan will serve as the strategic framework necessary to make meaningful progress towards these goals. An essential part of the Rural Health Action Plan is recruiting, training, and retraining medical professionals who are excited to live and work in rural communities. That is why we are launching a $16 million rural and remote family medicine resident physician bursary pilot program to support family medicine residents who want to practice in rural and remote communities. The program will provide up to $8 million over 2 years to qualified medical students. In return, bursary recipients will commit to delivering comprehensive patient care in eligible communities for 3 years after completing their residency. In addition to the bursary program, we are also implementing 2 new grant programs, including an $800,000 Medical First Responder Grant Program and a $600,000 Emergency Medical Responder Education Grant Program. They will help fund the creation of new medical first responder programs in communities with limited access to healthcare services and help in our ongoing effort to retain our most qualified medical personnel. Our commitment to supporting rural and remote communities remains steadfast. By investing in programs that attract and retain healthcare professionals, we are establishing the foundation for a sustainable, accessible, and equitable healthcare system. And by adopting the Rural Health Action Plan as our guiding framework, we are bringing together the crucial components needed to improve healthcare for all Albertans and provide opportunities for future physicians and other critical healthcare workers to live and work closer to home. So once again, I think this is great news, and I'm looking forward to sharing more with you as time goes on. I'd now like to invite Parliamentary Secretary for Rural Health, Martin Long, to the podium. Oh, there you are.
Just hiding right over there. Thank you, Minister LaGrange, and everyone for gathering. I'd also like to take a moment and thank the Attraction and Retention Committee and the members of the Healthcare Foundation for their efforts in Hinton and their communication with me personally over this last number of months. Over the past few decades, Alberta's healthcare system has been under immense strain. Rapid population growth is a significant factor contributing to the challenges we face in healthcare. Access to physicians is equally concerning. These concerns have left both urban centres and, more importantly, rural and remote areas struggling to meet the rising demand for medical care. Having spent many years living and working in these communities and now serving as a rural MLA and Parliamentary Secretary for Rural Health, I've witnessed firsthand the difficulties rural areas encounter in accessing essential healthcare services. Challenges such as geographic isolation, having fewer healthcare workers, limited resources, and longer travel times to specialized care are ongoing issues that need specific solutions. That's why we've developed the Rural Health Action Plan to focus on this important work. The action plan, led by a dedicated team at the Ministry of Health, provides a framework specifically designed to address rural healthcare needs, and we have ensured that it aligns seamlessly with existing initiatives like the Alberta's Health Workforce Strategy and modernizing Alberta's primary healthcare system. The action plan consolidates all current rural healthcare initiatives and future strategies under one plan. And over the next 3 years, it will guide us as we work with our partners to ensure Alberta is able to attract, recruit, and retain healthcare professionals to strengthen the capacity and sustainability of our rural health system. In addition to this, we are doing everything we can to make rural communities an appealing place for future physicians to live and work. Programs like the Rural and Remote Family Medicine Resident Physician Bursary Pilot Program and the Medical First Responder Grant Program and the Emergency Medical Responder Education Grant Program have been designed to both attract and support family medicine residents and emergency medical responders who are eager to practice in these communities, and often these are their home communities. We understand that practicing in these rural and remote communities in the province can be challenging. That's why we are providing financial assistance and resources to encourage more residents to consider a rewarding career in rural medicine where their skills are uniquely needed and valued. Where community still understands community, where you're embraced by an entire region of people and thanked on a regular basis for your efforts in delivering that health care. I'm hopeful that the plan we've developed through the Rural Health Action Plan will pave the way for a sustainable, resilient, and equitable healthcare system that serves the healthcare needs of every Albertan, no matter where they live. Thank you. I'd like to invite Mayor Nissen to speak.
Thank you. I'd like to thank Minister LaGrange and MLA Long for coming to our town to make this announcement about healthcare. I'd also like to thank my fellow councillors, Councillor Kristen Chambers, Councillor Trevor Hawes, Councillor Stuart Taylor, and Councillor Joanne Race for joining us here today. Thank you, Joanne. Along with the members of the Attraction and Recruitment Committee of Hinton and the Hinton Healthcare Foundation, along with our healthcare practitioners here in the community for coming and joining us today. Access to primary healthcare is a vital component of our society. All people should have access to the health services that they need when and where they need them. In Hinton, the number of doctors serving our community has fallen to the point of being unsustainable. Primary care services are at a critical breaking point, and this problem is not unique to Hinton. Many communities in rural and remote Alberta are facing the same challenges. This year, our town council declared a local healthcare crisis after hearing from innumerable residents who have been struggling with the reduced healthcare capacity not only in our town, but in our province. Healthcare is outside the focus of municipal government, but it is our job as municipal leaders to ensure a healthy and safe community for all. And we've stepped up to do whatever we could at the municipal level to address this issue, and we've advocated for action from our provincial government. And today, I can say that our cries of help have been heard, and they've been answered. Today's announcement from Minister LaGrange brings us hope. This initiative is an exciting step in improving healthcare access in rural and remote municipalities just like ours. And we thank the provincial government for their commitment to taking swift and ongoing action to support and stabilize not only primary healthcare, but all healthcare in our communities. As we move forward through these difficult times, we will continue to advocate for improved access to healthcare and work diligently to attract new medical professionals into our town. Healthcare is an essential service for all Albertans, and we will continue to do our part to ensure that Hinton residents have access to reliable, consistent healthcare at all times. This new initiative announced today and funding commitment from the province of Alberta is extremely welcome news, and we believe it will help solve some of the unique challenges that rural Albertans face when it comes to encouraging healthcare practitioners to practice in their communities. We're elated at this announcement, and I have faith that this is a step towards part of a sustainable solution for all Albertans. Thank you very much, and thank you, Minister LaGrange.
We now have some time to take questions from media. If you could please state your name and outlet, and we will be taking one question and one follow-up today. We'll start here in the room at the microphone in the front, if anyone has questions.
Hello, Peter Shook here of the Jasper Fitzhugh. I was curious about exactly how many physicians are currently in Hinton and what the timeline would be to get more physicians in Hinton. Thank you.
Well, I don't have the exact number in front of me. Maybe the mayor knows exactly how many family physicians are currently in Hinton, but I know that we're working very hard. I know that through various efforts, right now I know there's locums that are coming in as well to help fill in spots, but we are actively looking to recruit more family physicians in particular and physicians in general to make sure that there is the right complement for the number of people that live here in this community. Something that I've been able to do since last fall is put in stabilization funding for family physicians. We've been able to put in $257 million over 2 years, of which $157 million is already out the door to make sure that we stabilize as we work towards a new family physician compensation model, primary care physician compensation model. So we're very close on that. And this new program, bursary program for medical residents, will also help attract medical residents to rural remote communities with a return of service. So they're going to be able to give us back 3 years for a significant investment in their education. So many ways that we're trying to address the issue, but there is no silver bullet. We have to try many different avenues to get the right complement here. I'm not sure if the mayor wanted to share anything.
Just to speak to the number, we still have 6 full-time equivalent family physicians working in the community. The physical number of physicians is a little bit larger, but that's what we're able to fill out for shifts at this time. Thank you.
I don't see anyone else in the room, so we'll move to the phones. Operator, can you put through our first call?
And your next question comes from the line of Tyson Fedor with CTV News Calgary. Please go ahead.
Hi there, this is for the minister. We've spoken to some family doctors, especially here in Calgary, who say that they have not received any flu vaccines or COVID vaccines this last year they had received the flu vaccine at this point, and a lot of seniors have been wondering where they need to go to get these vaccines. So why is that the case? Why are these vaccines not being delivered in a timely manner? And what is your ministry doing about that to fix this?
Well, this falls under the purview of the federal government. So the federal government are the ones that approve through Health Canada the vaccines for any particular year. They'll approve a particular vaccine for a particular strain of flu, et cetera, for COVID, RSV, et cetera. We are awaiting that finalization, and then they are also the ones that procure en masse for the whole country. And my understanding is we are on track to receive our vaccines by October 15th, which is next week, or shortly thereafter. I think we're the 3rd, so within 12 days. My understanding that we are still on track, but this does fall within the purview of Health Canada, and we continue to advocate to make sure that we get the vaccine quantity and in a timely fashion from the federal government.
And just to follow up,
Sure.
Currently 14 temporary service disruptions or ER closures across Alberta at this current time. First of all, what's being done to attract ER doctors here, and when will we see the announcement on a new funding model for doctors to keep them here in this province and keep clinics open?
Well, we continue to recruit for our emergency rooms. Alberta Health Services is continuing to have that recruitment. We also have an ARP, which is an alternative compensation model for family hospitalists that we are in the process of finalizing as well, along with the primary care physician compensation model. We are very close to finalizing that as well. As soon as we get those out the door, then obviously that will make a difference, but we do have processes we have to go through, and I've been repeatedly saying we're still going through our processes on those particular pieces, but we continue to actively recruit. Alberta Health Services continues to actively recruit in high-need areas of healthcare professionals.
Operator, can you put through our next caller?
Your next question comes from the line of Jack Farrell with the Canadian Press. Please go ahead.
Hi, I also have a question for the minister, also, I guess, related to recruitment. So David Harrigan with the United Nurses of Alberta tells me that part of the kind of difference between AHS and the United Nurses right now is like a disagreement on how best to recruit nurses. The union's position is like you improve job conditions, pay for nurses, and you'll have people that want to work here. And David Harrigan tells me that AHS is kind of taking a position right now where they want to expand essentially the pool that they can hire from by hiring outside of the bargaining unit. So I'm hoping you can kind of just touch on recruitment efforts for nurses as well as that hiring from outside the bargaining unit part of that too.
So we've been actively recruiting more nurses into the province, and I know that over the course of the last year we've had added more than 4,000 nurses to the province. I know there are active negotiations going on. I can't speak to those negotiations. Of course, we have to bargain in good faith, and so we will let those negotiations take place, but I know that AHS is very committed to hiring local nurses. My understanding is that they will be hiring the vast majority of nurses that are coming out of our post-secondaries here in Alberta this year, and I know that they're actively looking to make sure that we have the nursing complement we need within this province. So again, I can't speak to the negotiations. Those are ongoing, but I do know that we actively recruit for nurses.
Fair enough. And as a follow-up, so UNA, of course, I don't need to tell you, it's not the only union right now that's in the bargaining process with the province, AUP being another kind of massive one. In both cases, both of those unions are seeking, raises over 25% over a certain number of years, but the government's counteroffer has been 7.5 over 4 years. David Harrigan suggested to me that there is the possibility that the province is kind of trying to find a balance between all the unions so that they don't set a precedent, by signing the UNA's requested raise, for example. I guess with so many of public sector workers in Alberta going through the bargaining process, what is your kind of hope that we don't see kind of massive strikes over the next few months?
Well, you are absolutely right. We are in contract negotiations with every healthcare union in the province, and so we have to let that process take place. We have to make sure that there is the ability to bargain in good faith, that the items are brought forward from each side. That's what negotiations are about. I know that typically each side starts with a position and they land somewhere that is agreeable to all sides. We need to let that process take place. Of course, we will plan to mitigate any situation should we go to something that's adverse, but I really believe that the parties are at the table in good faith, bargaining in good faith, and I believe everybody wants to come to a good decision on it. So I can't speak to specifics. That would be inappropriate of me to speak to specifics of a negotiation, but I know everyone at the table really wants to get to a good resolution on the bargaining.
Operator, can you put through our next caller?
Your next question comes from the line of Brad Corin with Post Media. Please go ahead.
Hi. This question is for MLA Long. As you know, in your constituency in Whitecourt, there are a lot of people who feel that one way to improve rural health care locally and to attract doctors is that we need a new hospital. Will the action plan be going into specific infrastructure needs like that?
Sorry, Brad, can you repeat the question, please?
Can you clarify that, please? In your constituency in Whitecourt, a lot of people feel that to improve local health care and to attract new doctors, one thing we need is a new hospital. Will the action plan be going into local infrastructure projects like that? Well, so on Whitecourt, I am aware that the government has given planning funding to Alberta Health Services for figuring out the path forward as far as the service plan for that facility. On the attraction piece specifically for Whitecourt, my last update in Whitecourt is they actually have 4 physicians who are accepting new patients currently because they have an adequate number of physicians to meet the needs in that community. So, while it can be a deterrent for recruitment, it currently isn't creating barriers in Whitecourt.
But will the action plan be talking about the need for new infrastructure, like new hospitals and communities?
So the action plan really is looking at the facilities that we currently have. Are they being utilized the way they should? What is required to make sure that they have a core level of facility of services, so to speak, of services that are required in those communities? We're actually looking at the whole province to make sure that our rural facilities are sustainable. So what's needed to make them more sustainable, what has to happen, what needs to change, are the facility themselves, do they need upgrading, what's necessary, do they need to be replaced? All of those things will be factored into the Rural Action Plan as part of the overall look and strategy.
Operator, can you put through our next caller, please?
Your next question comes from the line of Chelan Skowski with TTV News. Please go ahead.
Hi, thank you so much for taking my question. It is for the minister. It's back to my colleague's question on vaccines. If this is a federal issue, are you concerned that this delay from the feds is putting further burden on our healthcare system that could have otherwise been preventable? Are you concerned our hospitals will fill up faster with people that aren't getting the vaccines either in time or at all, particularly seniors or those with a health condition?
My understanding is that this is fairly consistent with what we have seen in previous years in terms of when the federal government rolls out their approval of vaccines and also when they provide them to the provinces. So we are pretty well on track, similar to other years. It's always a concern when we get into flu season, respiratory virus season, because of course that puts additional strain on our hospitals, particularly our ERs. And so we always want people to make sure that they're doing what's best for them. If they feel they need to go and get their vaccine, to encourage them to do that as soon as it's available to them. But we do have, more people in our province. So overall, our infrastructure are seeing more volumes going through our ERs and our hospitals on an average basis.
Just as a follow-up and to another point of this, can you provide any more information about the AHS recruitment, specifically of ER doctors? You mentioned earlier that there are recruitment campaigns AHS is conducting. How many doctors are they looking to hire, and specifically where geographically are they most in need?
You know what, I don't have those numbers in front of me, and we can get back to you on that, or at least get the CEO of AHS to get back to you with those specific numbers. I just don't have them in front of me.
We have one more question in the room.
Thank you, Minister. Thank you very much for coming to Hinton. Joanne Race, Town of Hinton Council and Attraction and Retention. Could you repeat how much money is in play for the 2-year bursary and the 3-year program?
The 2-year bursary, okay, I need my binder in front of me. I know it's $8 million for the, let me just get it so I give you the exact numbers here. It is, should I have that right at my fingertips here? Too many pieces of paper, but let me get that for you.
Oh, okay, thank you.
We'll get that information
We'll follow up.
over.
Yeah, the $8 million over 2 years is for the qualified medical students, so that's the bursary program. Is the $8 million over 2 years, and for the medical first responders grant, it's $800,000 for the grant program, and then $600,000 for the emergency medical responder education grant. So of course we've got some to build the program and then also to do the training. So $1.4 million for that, and $8 million over 2 years for the bursary program.
And that's all the questions for today. So that ends today's news conference. Thank you.